How do HPV vaccine breakthroughs reduce reproductive cancer rates? Imagine a world where fewer women face the threat of cervical cancer and other reproductive cancers. That world is becoming more possible thanks to advances in human papillomavirus vaccines. These breakthroughs work mainly by stopping high-risk HPV infections that can lead to cancer. The vaccines target the HPV types responsible for about 70% of cervical cancers, especially HPV-16 and HPV-18. By preventing these infections, the vaccines interrupt the process that can turn a normal cell into a cancerous one. Research shows that HPV vaccines are highly effective at preventing infections, precancerous changes in the cervix, and ultimately cervical cancer. When girls and young women receive the vaccine before they are exposed to HPV, usually before they start sexual activity, the reduction in cervical cancer cases is remarkable. For example, data from many countries show an 86% decrease in cervical cancer among girls vaccinated at age 16 or younger. Even those vaccinated between 17 and 19 years old see a significant 68% drop. However, for women vaccinated after age 20, the benefits are less clear, mainly because many may have already been exposed to HPV. The vaccines also help prevent other HPV-related conditions like genital warts, which further shows how well they work at stopping the virus from spreading. As more people get vaccinated, communities benefit from herd immunity, meaning even unvaccinated individuals are less likely to contract HPV. This creates a safer environment for everyone. There are different types of HPV vaccines available: bivalent, quadrivalent, and nonavalent. The nonavalent vaccine offers broader protection by covering additional high-risk HPV types such as 31, 33, 45, 52, and 58. This expanded coverage can help reduce the overall burden of HPV-related cancers, especially in areas where these types are common. From a reproductive health perspective, HPV vaccine breakthroughs are vital because cervical cancer remains a leading cause of cancer-related illness and death among women worldwide. By preventing the initial infection, vaccines help stop the development of precancerous lesions that can turn into invasive cancer. While HPV is not linked to testicular cancer, preventing HPV-related cervical and other reproductive cancers plays a crucial role in overall reproductive health efforts. In summary, HPV vaccines reduce reproductive cancer rates by preventing infections with the high-risk HPV strains that cause most cervical and other reproductive cancers. They lower the chances of developing precancerous changes that can become invasive cancer. The best protection comes when the vaccine is given before exposure to HPV, which is why vaccination programs focus on adolescents before they become sexually active. Newer vaccines that cover more HPV types offer even greater protection. As vaccination rates increase, we see not only individual benefits but also community-wide protection through herd immunity. These advances complement safe sex practices and awareness campaigns, helping to lower HPV transmission and reduce cancer risks. To get the most benefit, it's important to follow local health guidelines and consult healthcare professionals about vaccination timing and other prevention strategies.